Hi there.
Hey,
Hello. And welcome back. This is another episode of Between Two Teeth.
22 teeth.
Between Two Teeth, right there. We're your hosts. I'm Steph Ganter, and this is Bob McNeill. And what are we going to be talking about today?
We are going to be talking about the experiences of a new doctor,
I see. All right.
of which I am not one.
Oh, not your experiences. Is there a new? Is this me?
I guess it is you. And why don't we just get right into it? You've been out in practice now, coming on 3 years as a.
It doesn't feel like it.
Okay.
Feels like a lot more than 3 years.
Really? Tell me about that.
Right. So when you get out in private practice, there's a lot of stuff going on. You're not just a student anymore.
Well, and you got hit by COVID too.
Right.
As far as entering into practice at that time.
Yes, it's completely different when you're not only a new doc, but you're also being hit by a pandemic. So pandemic aside, because we all went through that, I feel like that's par for the course for everybody. A new doc, though, you don't know what you don't know.
You were pretty confident coming out.
If you know me, you know I struggle with that.
Yeah.
I always feel as though, wow, really? It's easy for me to get off base, and I don't think I'm alone here. I think several new docs out there.
What were you most scared about, though?
Can I answer one question at a time? Is that okay? Am I going too slow for you? I'm a new
bit.
doc. Apparently, we're really slow at getting
and
to the point.
If we could speak
and getting to the point. So,
and to that point, it is difficult when you're in practice with someone else, and it's difficult for the other doc to be patient.
It is so challenging.
You have to tell yourself that constantly.
Because as a new doc, there's a certain sense of pride there. You went from being top dog in your dental class, your dental school. You're a senior when you graduate. All of the first year.
Were you really top dog, though?
All of the first years are looking up to you, whether that's a senior resident or you're a senior dental student. And then you get out, and guess what? You are at the bottom of the totem pole. You're actually
was hard. That was hard for you.
It was, and you're actually lower than the bottom of the totem pole. You have people that haven't graduated any college, quite frankly, that have been working there for 20 years sometimes out of private practice. And suddenly these people...
And they know the system and you don't.
Right. They know the system and you don't.
And so, was that tough for you?
Yes, it was. Can I tell my story, or?
Well, I'm trying to pull it out of you.
Pull it out of me.
Yeah.
Okay, I guess I'm doing a bad job.
Yeah. Well.
So you get out and you have these people that your whole life you just thought, okay, if I go to school, or at least for me, I thought if I go to school, that means not that I'll be better than somebody, but that'll give me some boss like presence in the office. I'll be top dog. I don't know. Maybe not. And it wasn't that. It actually wasn't that at all. And so,
was it easier once you figured that out? That okay, I know we did an episode on expectation management, both for patients and for life.
I was fortunate in my periodontal residency. I had a variety of program directors. However, I did have one program director there, Dr. Garth Griffiths, and he would always...
Are we allowed to mention names?
We're not allowed to name drop. I think so. Okay. And he was great. He always taught us that you win more favors with honey than with kind of brunt and brute force. And so what that taught me was I had to respect the people that had the knowledge that I needed. And it wasn't about me anymore. It was about how can we treat this patient and get this patient from consult to treatment to post-op all safe and
almost lost a tooth there.
Safe and highly satisfied. And so that was the idea, and that is where a change in thought process, especially how I viewed myself and how I had to interact with the team.
So what advice would you give someone who's just getting, maybe they're a senior dental student, just starting practice?
I would say lower
you can say it. Lower your expectations.
Lower your ego.
I was going to say the word ego, but I wasn't going to do it quite yet.
As a guy, you probably don't have to... This is not going to be a nice comment. Right, fair enough. But as a guy, you probably don't have to do that as much. If you're a tall guy, especially.
With one of our other episodes, we talked about some of the nuances of female leadership.
Yes.
And I certainly can understand the challenges there.
And to kind of finish that thought, if you're a female, this is challenging. You have every right and entitlement that any guy would, coming out to be as egotistical as anybody. However,
should you be though?
And that's a different
and I guess
question.
it's tough because you've been in dental school for so long,
right?
And now you're out and you're expecting the gates to open up,
right? In dental school, you're not working with a female staff. It is different, and a female staff is going to respond differently to a guy doctor versus a girl doctor, and it has nothing to do with your qualifications. It's just honestly,
so it's a nuanced approach.
It's a nuanced approach.
What else would you advise for new dentists?
I would say that people management is going to be, it will make or break you in private practice. Can you be likable enough with your patients, with your staff? Because at some point, money will not keep your staff there.
Were you scared?
I don't think, yes, I was scared. I of course I was scared. And it's tough to show fear because when you get out, you don't want to get fired for being too slow, but you want to treat people right. You want to have confidence and show confidence to patients. And by the way, when they smell out that you're not confident, it makes you puff up your chest even more.
Yeah. Sometimes you got to fake it till you make it.
And it's tough to understand how much to fake it until you make it.
Right. And you obviously don't want to jeopardize a patient. And I would say, I hate to mention that I'm on the state dental board a little bit. However, we do see a lot of challenges with new practitioners, and we do see a lot of challenges where a practitioner is still trying to figure out how to work all the stuff and all the different equipment and all the different materials that are completely new to them. And they may have an administrator in the practice that's saying, you need to do this and this and this, and they don't have a full, complete understanding of their roles and responsibilities as the doctor, and that gets you in a bind.
And I love that you're bringing up that kind of practice environment. I've had one colleague of mine talk to me about her experience where the senior doc in the practice and the newest partner, they got the best stuff, and she was left with
that's the way it's supposed to go.
Well, maybe I'll feel different about this when I'm 20 years into practice.
You will. You'll have some new person say, you're getting that room, you're getting the small room, you're getting the old stuff. And you do want to support.
So that's
you want to support the new doc, make them successful, but don't show up and think you're like, all right, I want all the best of this and that.
When two words come to mind, delayed gratification.
Yes.
And a third word, entitlement.
Yes.
And these words have negative connotations to them and positive. We are where we're at. We did it. We are successful. We graduated, but there's a new challenge.
Now it's a new adventure.
It's a new adventure. And I think that it's really challenging to go where you feel, I mean, if you were an award winner in dental school, if you're at the top of your class
or the bottom,
my thing is, if you have a healthy ego and a strong ego,
I wasn't right at the bottom.
We just like a step above. It makes it challenging. And so you have to reset that ego and realize that if you want to be, what is your real goal, and keep that at the forefront.
And it's a journey, and it's going to take time, and you're going to fail and succeed and fail and succeed. You're going to do that professionally. You're going to do that personally. And I think having mentors around you and having a peer group around you who are going through it together, and you can share stories.
And I love that. And we'll wrap up with that point, is having a peer group around you to kind of commiserate with. And, it's great for everybody. And having those opportunities to talk to your peers about what you just went through, and they might have some helpful advice for you. And if anything, just to lend an ear. But thanks, guys, for watching.
Thanks for lending your ear to us.
Thanks for lending your ear, and we love the tapes too. This has been another episode.
It's a lot easier than holding it. My tape is failing me shortly.
Again, I'm one of your hosts. I'm Steph Ganter. This is Bob McNeill.
If you love what we're talking about, please add some comments. Please subscribe, whichever spot it is. Please hit subscribe. We want to help you on your new adventure.
Yes, we do.
Yeah.
Thanks, guys.